our second Parkinson's presentation on the different therapies that we use for Parkinson's patients. And I appreciate all of you for coming. And I really appreciate my friends in our rehabilitation department for getting together and doing this, especially Leslie and Jan and Marion. You guys are the best. So thank you so much for doing this for our members. And I know it's always hard when you're working with a big team and taking extra time to share your knowledge with us. So thank you. And with that, I'm going to have Leslie take over the program.
Okay. Thank you very much, Melissa, for organizing and getting this together. And thank you all for joining us today as we talk about mobility and communication strategies for Parkinson's patients. We'll be discussing how Parkinson's affects your movement and your ability to communicate. It's well known that exercise of all kinds is good for everybody, but it's even more important for patients that have Parkinson's. Why? Because Parkinson's affects the muscles throughout the body slowly over time. And this muscle movement decreases, and the brain doesn't recognize that that muscle output has decreased because it's gradually occurring, okay? This gradual decline in the muscle movement affects a person's ability to walk, care for themselves, and talk. But fortunately, with active participation in exercises and therapies, the effects of Parkinson's can be significantly decreased. So today I have three wonderful therapists who will educate you on a program that we offer here at Adventist Health Glendale that addresses the physical mobility and communication deficits affected by Parkinson's. I'm pleased to introduce a part of our team, Carrie Lee, who is an occupational therapist, Joanna Jimenez, who is a physical therapist, and Shay Hutchison, who is a speech-language pathologist. And each one of them will address different areas and exercises for Parkinson's patients. So let me turn it over to Carrie Lee, our occupational therapist, who will discuss some of the program parameters that we offer here at Adventist Health. Carrie Lee, all yours.
Hello, everyone. Thank you for joining us for this presentation. As you may have already heard from Dr. Lee's presentation a couple of weeks ago, Parkinson's disease affects movements. It makes movements. Give me just a second while I pull up. Oh, sure.
We're going to share our screen.
Yes. So the Parkinson's disease, it makes movements smaller, it makes movements slower, it affects balance and posture, which puts people at risk for falling. It can also cause tremor and affect fine motor coordination. So it can make small fine motor activities like writing and buttoning difficult. It can also affect the muscles involved in speaking, making your voice soft and difficult to hear. I'm just going to move on to the next slide. So there have been many researches done over the years, and they have all shown benefits of vigorous exercise in slowing down the progression of Parkinson's disease. Exercise improves not only the motor symptoms of Parkinson's disease, but it can also have positive effect on mood, cognition, and depression. So there is one treatment program that's been designed specifically for people with Parkinson's disease. It's called Lsvt Big and Loud. This program has been researched for over 20 years, and studies have shown that Lsvt Big and Loud can lead to significant changes in people's balance, walking pattern, and speed and speech. These exercises, as Joanna will demonstrate later, involve the whole body, and they are personalized for each person, but all built around the ideal of think big and talk loud as its guiding principle. It reteaches you how normal movements should feel. Often these movements at first may seem strange because they may seem bigger than what you're used to, but they are comparable to those of people all around you. Over time, through the program, you can learn to recognize these larger movements as normal. Let's see, I'm going to share another. Okay, so some of the specific benefits of doing the Lsvt Big and loud exercises. It can lead to faster walking with bigger steps. It can lead to improved balance, which would translate to less risk of falling, increased trunk rotation, improved vocalization, and improvement in your daily self-care activities, things like getting in and out of bed, getting up from chairs, and getting dressed. So Lsvt is unique because it focuses on movements with large amplitude and is done with high intensity, as research has shown that the exercise that's most beneficial are the ones that are done in high intensity. So if you or someone you know has been diagnosed with Parkinson's disease, you should see a neurologist and get a prescription for occupational therapy, physical therapy, and speech therapy. So the therapists here at Adventist Health Glendale have all been trained to instruct people in Lsvt Big and loud exercises. So the sessions are about 1 hour long. You would come in 2 to 4 days a week for 4 weeks or longer. The therapist would customize the exercise program depending on your clinical presentation. Lsvt Big also incorporates daily homework and carryover exercises, which promotes people to integrate the exercises that they learn in the clinic into their daily life. So I am going to share with you a short video. Okay. So this video shows a person, a gentleman that is walking before he received the Lsvt Big, went through the program. And then the screen on the right side of the screen is the same person after he received the Lsvt Big training. You can see the different speed that they're walking in. You can see that the gentleman on the left is the same person, has just barely left the entrance, whereas the second person is now in the parking lot and walking past his own car. So you can see the increased velocity of his walking, improved arm swing, just the posture. He looks more confident and secure and is walking beautifully. Okay, so I'm going to stop the video. All right. So next, I'm going to, Joanna's going to come over and she's going to demonstrate some of the exercises that we teach to our clients and how we can customize it for some patients. So Joanna's going to come over right now.
So hi everybody, my name is Joanna Jimenez. I'm so honored to share what we teach to our Parkinson's patients, and our eyes as therapists are trained to look for asymmetry in movement pattern, like decreased arm swing on one side or reduced foot clearance or slower than typical gait pattern. We also look at the limited trunk rotation, or your posture if it's this way, we try to increase it going out this way. We also work on, we look at the decreased fluidity, especially when a person approaches turns. So our goal is to restore the amplitude and movement patterns, normal movement patterns during walking and activities of daily living to within normal limits for their age. Okay? We try to make these like minor changes to gait and balance, because we know that if we don't address it now, it's going to be a bigger issue later on. So during treatment, we start with the basic maximal daily exercises. These are exercises 1 to 7 that I will demonstrate, and also functional tasks like sit to stand, big walking, which is, these are good foundation for good quality movement and symmetry patterns. Okay, so we progress. So let me demonstrate first the basic maximal daily exercises. So we start with the sitting exercises like this. Okay, so we always start big. So nice, big posture. So usually they start this way, but we try to cue them to start nice and big. Okay, so we do first. So I'm going to give you maybe like 1 or 2 samples on each side. We usually do 10, but for demonstration purposes, we're going to do just 2. Okay, so we're going to go this. Exercise number 1, we're going to go forward big, down big, up big, out big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So each time we count, we try to make the arms kind of telescope out, so that way the movements will be bigger as they continue doing them. So we go again, forward big, down big, up big, out big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The second exercise is sitting exercise. Also, we go this way from the side. We're going to go out big and up big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we come back big. Okay? So out big, up big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're going to do the other side. We go this way, out big, up big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Out big, up big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So those are the exercises 1 and 2 in sitting. We're going to do now the standing exercises. All right, for the standing exercise, we have a So we're going to do the forward step, nice and tall. Always the foundation has to be nice and tall, confident, ready, and 1, 2, and 1, 2. Next, we're going to do the side step. So we go this way, 1, 2, this way, 1, 2. So next we're going to do a backward step. So we go forward big, back step, and this way. 1, 2, 3, 4, 5. Or we can do just forward, back, and this. Okay, so next we're going to do the standing rocking exercises. You just have 1 foot forward, 1 foot back. Going this way. Usually start with the weight shifting first with the legs, and then we integrate arms. 1, 2. So we usually do 10, and we're going to do the other side too. This way, and 1, 2. Next one, we start this way, rocking side to side. And we go 1, 2. This way, side to side. 1 and 2. All right. Next, we're going to do the functional tasks, like the sit to stand. So these tasks are basically like establishes the good foundation for quality of movement for symmetry. Okay, we're gonna go forward big and then up big. Forward big and then down big. Because usually with Parkinson's, we see the patient plop back or they go really fast. So we're gonna go really forward and then up and then forward and then go down slowly and all right. So we try to progress. We have them do these exercises and then we progress by adding dual tasks to make the daily activities easier for the patient. So dual tasks, we integrate memory and balance at the same time. So this could be like big walking or walking over a curb cone and doing some assigned tasks. So okay, so stepping over a curb, that's part of the activity, but we also assign them like dual tasks. So doing two things at the same time. So say for example, the green dot means if you step on it, you have to, so green is the color of grass. So I'm gonna put over here, when you step on it, you have to bend your knees 3 times. So 1, 2, and 3. If you see the blue dot, blue is the color of the sky. So when you see it, you're going to clap your hands 3 times. 1, 2, 3. When you see the red dot, you're going to turn around. So this challenges the patient's memory. And so, so this is like a wonderful time for them to kind of associate things with something where, say for example, I step on this, I don't have to turn around. And then I step on this, blue for the sky, and green is the color of grass, so I'm gonna get like I'm sitting on the grass. Okay. All right, so next, Shay will be talking about speech impairments and how she is able to address this using Lsvt Loud. Thank you very much.
Hi, everyone. You might remember me, I did a presentation a few years ago about voice as well. So actually this kind of goes alongside the presentation I already did a few years ago. If you missed it, or if you were there, it'll be a refresher. If you're new, you get it for the first time. So with speech therapy, we focus on Lsvt Loud, and that's the program that we do. And a lot of times, the symptoms that you'll have when you have Parkinson's are, you might have monotone speech, so sounding like this all the time. You might have a vocal tremor, so your voice kind of sounds like this. You might have decreased speech clarity, so your speech might sound what you might describe as slushy or mumbling. You might have a quieter voice. Some people might say that your voice is softer than usual. People have a hard time hearing you. And people might even ask for repetition. They might say, "What did you say? Can you tell me that again?" You also might experience running out of air when you talk. So I want to share a little picture for you. The words will probably be a little small. Don't worry, it's not, I just want the picture is really what I'm trying to share with you. So here, this is a picture of kind of our voice system. Carrie and Dr. Lee have mentioned that, you know, when you have Parkinson's, we have all of these systems that are working for us. But as we have Parkinson's, those systems begin to kind of discoordinate with each other. When we create our voice and our speech, we have three systems working together. We first have our respiratory system. So down here, it's our breath. Our breath is the power for our voice. The next system is our phonation system, or what I like to call our voice box. So our breath, we breathe in, our breath pushes up, comes up and vibrates our vocal cords to make sound. And then the last system, it says resonance up here. Now the sound is coming up into our mouth and our nasal cavity. And that's where we actually shape the sound for our voice or our speech. So that's where we create our speech sounds and where we articulate. So we need all three of these systems working together so that our voice is the most optimal. So people can hear us and understand us. That's the goal. Okay. So when we have difficulty with Parkinson's, for example, these systems are starting to discoordinate. So if someone is complaining that they can't hear you, maybe it's because you have decreased breath support, and that's affecting the whole system, right? We have decreased breath support. We don't have enough power to create our voice and for that sound to come out to create the speech sounds with our lips and our tongue. Something else I forgot to mention, another huge part of symptoms that Parkinson's patients will experience is kind of what we call a tongue tremor. So the tongue is kind of moving like this. Well, that affects our ability to articulate our speech sounds as well. Okay, so how do we help you with this? So Lsvt Loud, it would always be personalized to you, but there are 5 core exercises that we would go through. Okay, so I'm going to demonstrate each exercise, and just like Joanna did, these are always intended to be in sets of 10. But for demonstration purposes, we're just going to do a few. The reason 10 is important, or 10 or more, is we want you to build up stamina. If you just do 1, or if you just do 2, it's not really going to have a lasting effect. So the first exercise is just a loud ah, okay? So I will demonstrate it, but you want to take in a big breath and do a loud ah as long as you can go. Okay, so I'm going to demonstrate that, and it's going to be a little long, so bear with me. Okay, here we go. Okay, normally I can go longer than that, but I think I'm a little nervous. But you go as long as you can. All right, and that's building up your breath support and your stamina. I forgot to unshare this screen. You probably want to see me a lot bigger. This exercise, the long ah, is working on kind of pairing both of those, the phonatory system, the voice system, and the breath system together. So we're trying to coordinate those with this exercise. So you would do that 10 times with a regular, your normal voice ah. If you have trouble finding your normal voice, an easy way to find it is by counting to 3 and then holding that E, and that would be the sound. So let me demonstrate. You could say 1, 2, 3. That would be the note that you're doing. So then you would go ah, like that, okay? The next exercise is our high ahs. So a lot of times with Parkinson's, people, like I mentioned, have a monotone speech quality. So they're talking like this all the time, and their face is kind of flat also. We want to move the voice up and down to kind of give you that varying pitch. So your next exercise would be an ah jumping from your normal ah to a higher ah. So something like ah, and you would be holding that for 5 seconds, okay? You would go as high as you can go without your voice straining. So not ah, that's not great. You want it to go up comfortably. And I think as you do the exercises, you might find that your range gets a little bit higher. Another exercise, we would be doing the same thing, but going low. So I call them the low ahs. So you would start with your normal pitch, ah, and hold it for 5 seconds, and you would do 10 of those. Okay, both of those high and low is kind of working on your varying pitch so that when you're speaking, when we speak, we don't speak monotone, we speak kind of with a rise and a fall of our voice. The fourth exercise are what we call functional phrases. And these are things that with your speech therapist, you would come up with a list of 10 phrases that you say every day. Something like, good morning, would you like a cup of coffee? How are you today? I love you. And the meaning of this is, you need some reminders throughout the day to use your loud voice, right? And so by creating a list of things that you say every day, those become little tidbit reminders as you go about your day. So these would be specialized particularly to you. But instead of reading it just in your normal voice, good morning, how are you? I want a cup of coffee. We would want you to use your big, loud voice. Good morning. How are you? Did you get the paper? What's for dinner tonight? That sort of thing. You're practicing a louder voice because we're trying to teach your system through muscle memory and through high repetition of tasks to keep that voice, okay? Our final exercise is reading out loud for 5 to 10 minutes. So when we read out loud for 5 to 10 minutes, and this can be anything, some people read the mail, some people read scripture verses from the Bible, some people read their favorite novel, read a Facebook article, it doesn't matter. But using your voice and for 5 minutes is practicing for activities like talking on the phone or having a long conversation with a friend. But we would want you, instead of just blah, 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 reading with a quiet voice, you're really actively, once upon a time, there were 3 bears, or whatever. So those are the 5 activities that we would do that would be specialized to you. Okay. One other thing I want to mention, this is not a part of LSVT loud, but oftentimes people who have Parkinson's, if you're having speech difficulty or difficulty with your voice, you might also have trouble swallowing. The same muscles that we use to speak and use our voice, those same muscles are also used to swallow. So if you are having trouble swallowing, that's something else that a speech therapist could address, and I would encourage you to let your doctor know about it. Most of the time with Parkinson's, patients complain of liquid going down the wrong way because the liquid moves pretty fast. And so we could help you with some modifications when you're eating, just to kind of help you with that. That's all I have. So we can send it over to questions, Melissa.
Okay. Thank you so much, Shay.
You're
and
welcome.
to all of you presenters today, I really, you guys were amazing. And it was very clear. And I'm very grateful that we do have you here at the hospital, and that we do have all of these options for Parkinson's patients. I think that's fantastic. I'm going to go ahead and stop the recording. And then for everybody else that's here, if you can just type your questions in the chat, and the three presenters will go ahead and answer them as they pertain. They might pertain to different people. So I'm going to stop now. And there, okay, we've stopped.